I'm Ralph Hills. I live in Connecticut near New York City in United States. I've been on a 12-year AML journey, still under treatment. I'm also the patient chair of Know AML in London. My unique clinical trial has made me sort of famous for the last 10 years. I've given many speeches, and all I can do during those speeches, I recognize this from the beginning. I can never give anybody an advice. I can only be an example of hope. And if you stay alive, as I have, you come to balance in your mind, enjoying every day, compared to worrying about the days of illness, treatments, and fear that might return. So I try not to worry, reminding myself of the incredible joy that these past 12 years have added to my life. The unexpected path in my life, the scary, often fatal cancer diagnosis, followed by such a challenging recovery, has allowed me to give back a little these 12 years. Again, be an example of hope. So I thank my doctors, the progress in treatments, and my family and friends. For me, the only word I need to describe surviving so far is grateful.
Hello, I'm Anna Mamwell, and I'm a Know AML Ambassador in the UK. I was diagnosed with AML in 2015. I had a few months of treatment and have been in remission ever since. Survivorship is something you don't know anything about until you're in this position. So by that, I mean, previously, before I was diagnosed, survivors, you hear about survivors of traumas, accidents, etc. But I didn't see that would be something that I would feel ever in my life. And after this, there was a lot of things to process. A lot had happened, obviously, during my treatment. So in those first few months, I was sort of processing what had happened, and I felt like I was catching my breath again. I was just like let's just breathe. And obviously, in those initial few months or few years, there's still the medical appointments and things like that. So you're still very much a patient, and you're still kind of like going through it. But it was not long after I was in remission that I started to feel like different, like my life needed to be different from what it was before. Certain things were not important anymore, and it changed the whole way I viewed my life and my career. I knew, or I felt, it was a feeling more than knowing this immediately, that I needed to do something good, positive. My life needed to, or had to have purpose. I didn't go through all of that just to go home and not talk about it, not help. So much like Ralph, over the last few years, I've done so many talks and conferences to various audiences, from charities to researchers to pharmaceutical companies and the NHS in the UK. And patient stories have a lot of power. And I feel like I always said to myself, I'm not a scientist, I'm not a billionaire, I can't throw lots of money and do those sort of things to solve this and make things better. What I can do is share my experience to help with treatments and help people in the future. So helping other people that are newly diagnosed or that are similar to me. So I would also say to people, when you feel ready, reach out, find other people like you, because I did feel very lonely and very isolated. But finding those other people that had AML or very similar, and talking to them and sharing just little things like, oh, do you ever feel like really tired? Or do you ever, has your taste in food changed? All these things that come along afterwards that you feel like you can't talk to your friends and family about because they don't know. So for me, it was really, really reassuring and comforting when I did find other people through various means, through Know AML, through other charities and things like that, where I did find, people like me. And even now, 10 years on, I still talk to these people, and we will still say, oh, are you feeling this, etc. And for me, when I saw survivors that had gone ahead of me, it really helped me and gave me hope. So now that's what hopefully I'm doing for people, is that here I am 10 years on, and hopefully that will give people hope as well. So I spend a lot of my time helping with all sorts of different things, and quite often people reach out to me who have been newly diagnosed, or if they have a friend, a partner, anyone that like that, they will ask me questions as well, because I think sometimes people feel it more easy to ask other patients, or like that peer-to-peer thing, rather than asking a clinician or a medical person. So, I'm always happy to talk to people, answer any questions they may have, because I know myself how much that helped me. So it's very much about giving back, and knowing this disease means that a lot of people don't survive. I do that in those people's memory as well. There's people that I have known and that haven't made it as far as me. So in my mind, I'm honouring their memory by doing all these things and by being a positive survivor. But there are ups and downs, lots of ups and downs. I would say survivor's guilt is something that I didn't even know was a thing. And I started to sort of feel quite guilty about surviving. So that's something I had to explore, had to talk about, and had to, process. Also, don't be surprised if friendships and relationships change. And it's something that is quite common. I didn't realise this, but because you are maybe different, you have a different perspective on life. And it is a very, very big thing to experience. That can mean that some people and friendships don't really work anymore. And that happened to me with very, very long-term friendships, which is another thing I had to kind of go through. I had to understand that wasn't helpful for me anymore. I needed positive people around me and positivity all the time, because I was struggling myself. So I needed people around me that made me feel okay. So I had to leave some of those friendships. But I have spoken about this before, and then I found out that other people have experienced this as well. So again, you're not on your own. And that's quite an important thing that I think I want to say now, because I didn't know that would happen. I didn't foresee it happening, but it can do. So, but it's okay. And you do make lovely new friends as well, lots of new friendships. And my life has gone in a way that I never thought it would. I'm now a patient involvement, patient representative for the NHS. And it was just totally different to the career path I was on. So just kind of, if you want to go back to what you did before, that's absolutely fine. But if it doesn't feel a good fit for you anymore, that's absolutely fine as well. And these are things that I don't think are talked about particularly at diagnosis, because you are given the information about the diagnosis and about the treatment. And all these things that happen during your survivorship are things that you just kind of find out anecdotally, and you feel probably a lot of the time it's just me, and then that makes you feel very strange. But like I say, that's where talking to other people and these forums and support groups have been a really, really good, really positive experience for me.